Drugs in sport is the next contemporary issue. Historically, drugs have been prevalent for many years in sports, with some people taking them for psychological, social, or physiological benefits. There are a variety of different drugs that have been manufactured that benefit an athlete's sporting performance. However, these drugs can have adverse impacts on the athlete's body in terms of their health. And it seems in this day and age, drug testing has become the norm. People expect there to be illegal substances at major events, otherwise why would there be testings? Many people within an athlete's life can influence them taking drugs, such as coaches, people within the sport. Athletes might feel internal or external pressure to perform, so that's why they might want to gain an advantage so that they don't disappoint people. Steroids such as anabolic steroids are illegal drugs within sport. They increase the power and strength that an athlete has. The steroids actually help the athlete to recover. It decreases the time it takes for the athlete to recover so that the athlete can train harder for longer, therefore increasing their muscular power, endurance, and strength further. But there are side effects to steroids that can have negative effects to the athlete's body. For women, some of the short-term effects are excessive hair growth, and this is because they are increasing the levels of a male hormone in their body, which their body isn't used to. Also, the long-term effects for women are that the steroid deepens their voice, can cause heart attacks, strokes, and adapts their menstrual cycle, so it is abnormal, which results in consequences for their health. Some of the short-term effects for males are that it reduces sperm count, so there is a reduction in fertility. Also, the steroid can damage their heart. In addition, the long-term effects are liver disease or even liver cancer, heart attacks and stroke for males. However, it is very accessible. This drug is very common, as estimates show that there are more than $400 million worth of black market, so illegal sales of the steroid per year, costing around £40 to £50 per 100 mg per ml. So the athletes can use this drug obviously to increase power and muscular strength and muscular endurance. So for a footballer, this drug would help them maybe last longer within a match. They might have more energy to keep going for the 90 minutes. But typically, a footballer maybe won't use this sort of drug. It would be more a sprinter. Another drug that can be used is a beta blocker. These are a class of medication, and according to Adams et al. 2010, they prevent adrenaline and noradrenaline from exerting their effects on the body. This therefore can cause a reduction in heart rate, so reduces blood pressure and stops maybe levels of anxiety from rising, so that the athlete can stay calm, which results in reduced muscle tremors as well. Beta blockers are good for athletes such as an archer or a darts player that need a steady hand to complete their task. They are not necessarily used in football, as the players need as much oxygen to their muscles as possible. However, there are side effects. They include dizziness, weakness, fatigue, cold feet and hands, and headaches. So there obviously are limitations to this drug and can be harmful for the athlete. Diuretics is a drug that can be used. This increases the volume of urine output, therefore reduces the athlete's weight. Although there is a risk of the athlete getting dehydrated. However, there is an example where a women's footballer, Hope Solo, got caught taking a diuretic to reduce her weight. No one knows the reason why she took it, but obviously it would make her lighter, which could help her when she jumps and saves a goal. But she was actually let off. She didn't actually have any consequences. She just received a warning. There was no legal action, or she didn't have to pay any fines. She was just received a warning for taking that drug. Next is a stimulus. This is a type of drug that increases reaction time. So a sprinter might use this to get out the blocks quicker. EPO is an injection to increase red blood cells. So an athlete can insert EPO into their bloodstream, and this increases their red blood cells. So a footballer might take this to increase their muscular endurance so that their muscles don't fatigue during the game and they can last the whole match and extra time if needed. There is a more dangerous way of increasing the red blood cells, so increasing the EPO within an athlete's body, and that's blood doping. So this is a technique where the athletes remove a certain amount of blood. They freeze this blood, and then obviously the body stimulates more red blood cells due to the ones that they have just lost. And then the athlete, before a big match or race, they put the blood back into their body to increase the overall red blood cell count. So they have more oxygen when doing the exercise. Lance Armstrong, the cyclist, is probably the most famous person for getting caught doing this. It is illegal within every sport, and he faced the consequences for that. But blood doping can be very problematic as you increase the volume of blood within your body, and it could cause clotting of blood, which can be very dangerous for the athlete. Caffeine counts as a drug as it increases the alertness of a person, so they're more awake. However, within sport, it's not illegal. Caffeine can be monitored, and there's a certain limit that athletes are allowed to have in certain sports, but it's not an illegal drug. As drugs have become more of an issue, nowadays there's a lot done to try and prevent drugs used in sport through the use of positive role models such as maybe Lucy Bronze, Steph Houghton, Alex Scott within women's football. They set a good example. Therefore, younger athletes are likely to look up to them, and the behaviour that they display will be similar to the role models. So, which could reduce the amount of drugs that are taken in sport, as the positive role models have no association with any drugs. Therefore, younger people are less likely to feel that they need to take the drugs in order to be good. Also, anti-drugs within sport is made aware through organisations such as WADA, so World Anti-Doping Agency, the International Olympic Committee, and UK Anti-Doping. And within football, it is FIFA and the FA. They work with WADA to try and combat drug taking within football. They do this through education and making people aware of the dangers of taking performance enhancing drugs. So as sports have developed, the consequences for being caught taking performance enhancing drugs have increased. So if athletes are caught, other than health problems that the drugs could cause, there are fines and bans from the sport. So Hope Solo was given a warning due to her circumstances, but the bans and fines can especially be seen in athletics, as they are banned for a period of time. However, there is a controversial debate and division, as some people believe that drugs should be allowed in sports, as the athletes come back to the sport anyway, when they're banned. So why waste the money and time drug testing when athletes such as Justin Gatlin within athletics and the footballer Edgar Davids that take the substances, they came back to the sport anyway. So why should there be testing done, and why shouldn't drugs be allowed in sport if there's not going to be permanent or severe consequences for people actually taking the drugs? Also, people believe that if drugs were allowed, it'd be an even playing field, and it would make good entertainment, and maybe more money would be put into the sport due to spectators watching the sport, as the athletes would be performing to the best of their ability, so increasing the entertainment value. The reason why drug testing needs to be developed is because many people have found a way to mask the drugs by using other drugs, such as plasma expanders and epitestosterone, for example. Why should we just give in to taking drugs? They are illegal for a reason, and the sports can function without drugs, so why should we give in to the athletes that take them? Therefore, more money and time needs to go into the organisations to help improve drug testing and the education to young people about the effects that taking performance enhancing drugs can have. And then there also should be harsher punishments, such as even lifetime bans from the sport for taking illegal substances, because they are illegal. Research is a key aspect to controlling the drug issue within sports, and so is education. Luckily, within football, there has been limited occasions where athletes have taken performance enhancing drugs, but it's still an issue in other sports. So WADA and UK anti-doping still need to work with FIFA and the FA to control the issue and educate people about performance enhancing drugs so that they don't become a further issue within the sport of football.